Okay, so we are now in module 3, and we're going to look at some more of the physical health symptoms, going a little bit beyond stress and also some psychological factors. So, generally, coping and resilience is going to be dedicated based on some of our health behaviors. So, any action that we promote that as health is going to kind of qualify as productive behaviors. And so some of those things are like balanced diet. So you talk about, lots of vegetables and fruit and a little bit of meat, and trying to avoid a lot of fatty foods. Having regular sleep, I think, particularly when you're in college, it's very difficult to do, but you want to try to remain consistent on the hours that you get in and, you know, get in that 7 to 8 hours typically to really be really good. Nine's not bad. If you get into 10 or more, that's also can be kind of maladaptive. And then, of course, having regular exercise. So it not only decreases stress overall, but it helps the upkeep of your body in general. And we know how your body and your mind are linked together. So you got to have both working well to have them all working. And if you neglect your body, then your mind can also follow as far as having difficulties. Now, some of the part that goes along with healthy behavior is the availability of social support. And that social support will encourage positive health behaviors, which is going to improve things like your immune function. So, people who are more supported tend to have more resilient and effective immune systems. Your cardiovascular system tends to do better, and even your endocrine system. So, this is the advantage of having good social supports in place. And that's where most people enjoy just with that social interaction in regards to it. And look at all the positive outcomes you get with it. Now, as you get older and get married, and having a good marriage can be critical source of social support, particularly as you get older. And so we really don't want to overlook all of the positive aspects in regards to that. Now, there's a cultural factor that people who seek social support in different ways. And so the cultural differences between people for social support can vary, but providing that social support is going to promote the good health as much as receiving it. So, it's mutually beneficial. In other words, providing social support to others is also going to provide it to you. So you're going to reap the benefits in the same way. Okay. Now, there are some other factors going on here. So, lifestyle diseases that come into play is one of the most leading causes of death, affected by the various stress and health behaviors that are out there. You can also have psychological factors that are at least moderately associated with the course of cancer and some other health issues. So, being positive versus being negative, giving it a try, that sort of thing can really make a difference, even in physical health kind of issues. And then we also have social factors, just like we just talked about, as far as social supports. And that when we lose social support, it can undermine how well we comply with kind of unpleasant but vitally important medical treatments. So, for instance, somebody who maybe just recently had a heart attack, and the doctors come to them and says, you got to quit drinking alcohol, you've got to not eat fast food anymore, and all of this kind of list. That is a pretty big change and not very pleasant for people who enjoy the things, the kind of benefits of life. And if they have no social support, they're less likely to follow these directions that could eventually lead to their longer living. And then, of course, you get these dangers then that start occurring. So we really got to be aware of how this impacts things, and really can impact your life. Other factors that we want to look at is the issue of pain. Now, pain is adaptive. Pain signals typically that there is something wrong, and makes it so that it motivates people to seek some sort of treatment for that acute injury or illness. So, I recently had a little bit of a difficulty with my elbow, and if that elbow hadn't hurt enough, it wouldn't have motivated me to go to, say, the physical therapist or to my medical doctor to say, hey, what's going on? What's wrong? And I probably would continue to have kind of a malfunctioning elbow versus doing some exercises and such that could really help that progress. So pain is adaptive. It's, believe me, there are people out there, very few, who actually don't have pain receptors. And it's as dangerous or more dangerous not having pain receptors at all, because you don't realize that your body is somehow getting punished and is beginning to malfunction. So you need pain. But also, one of the things that we need to think about is that pain isn't always useful. In many cases, pain isn't a sign of underlying conditions that can be treated. And that gets into the subjective aspect of pain. And it's very difficult to evaluate, particularly when there's nothing identifiable as far as injury or illness. It's common when we talk about things like headaches, lower back pain, and people who are even anxious or depressed, which we talked about earlier this semester, tend to be more sensitive to pain, and they're less able to cope with it, or they're just simply more willing to complain. And that may lead to some, poor decisions being made, like the use of drugs, like opiates and stuff like that, to provide that sort of relief when it's not really good for them in the long term. So these are some of the psychological and health behaviors that can both assist us and help us for later survivability and quality of life, or, and of course, flip side, can hurt us. So, in our last module for this particular short chapter that we're going to look at in regards to stress and physical health, we're going to look at sleep wake disorders and just kind of highlight that there. And that'll be in module 4. So, stay tuned for that one, and we'll get to it right now.